and welcome to all of our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And here at Gold, we're getting ready for our Gold Neonatal Online Conference of 2023. And I have a special guest with me here today. Here with me is Dr. Leslie Parker. Welcome, Leslie. Good to have you here.
Thank you very much.
Lovely to have you here. We're going to talk about the topic you will be presenting on during the conference here in just a moment. But first of all, where in the world are you?
I'm actually at the University of Florida, which is in North Central Florida in the United States.
Thank you for clarifying that. Yes, and we see you have your logo there up for top 5 UF. That's wonderful there. Thank you so much. A fellow Floridian, as I can see here, as I am in the West Palm Beach area here. So you will be presenting on routine monitoring of gastric residuals, practice and research update, a very important topic. Before we get there, talk a little bit about your professional background and let us know what you're working on right now.
So I have been a nurse in the neonatal intensive care unit since 1985. I then went back and became a neonatal nurse practitioner, and I still continue to practice as a neonatal nurse practitioner at Shands at UF Health. In 2010, I received my PhD so that I would have the opportunity to look at some of the issues that we have in the neonatal intensive care unit that really doesn't have any answers. What I'm currently working on is a couple of different things, some different interventions to help mothers of critically ill infants make more breast milk.
Ooh.
And I'm also working on oral care, providing oral care to infants in the NICU. Is that a good thing? Is it a bad thing? Does it improve health? And also how long feeding tubes should remain in place in critically ill infants in the NICU.
All very important topics. We can't wait to hear back from you for one of our next conferences, because these are all, of course, topics that are of very much interest to our neonatal healthcare providers here as well. So let's talk about the topic that you're here for, the routine monitoring of gastric residuals, practice and research update. That gastric residuals are often used to direct feeding decisions and thus can result in delays or interruptions, right? And lead to increased risk and complications. So tell us a little bit, first of all, to our viewers who are maybe not familiar, maybe not directly working in the NICU, about this, and what we can look forward to hearing from you in the presentation.
So while I was working as a nurse practitioner, I saw that all of our babies prior to every single feeding had a gastric residual evaluated. And so in order to do that, the nurse would connect a syringe to the baby's feeding tube and withdraw the gastric contents. And feeding decisions were made based upon that. However, there really was not much evidence to support that practice, either in the neonatal population or in the pediatric or adult population. So I went and was very interested in this because it was costly. It took a lot of time from not only the nurse, but the nurse practitioner and physicians. And it also, we found, decreased the amount of feedings the babies were receiving and increased the length of time it took for them to receive full enteral feeds. So we did do a large study to see if it were safe and effective to stop doing gastric residual evaluations.
Fascinating. And this is what you're going to talk about, the study, correct?
I'm going to talk about that study, but I'm also going to talk about all the studies that have been done since that time, and some of the ways that we can consider changing our practice in the NICU, and also what people are doing around the world, why they're doing it, and some of their fears about stopping gastric residuals.
Yeah, absolutely. I can't wait to hear from you to find out what the research actually says. Sometimes, why does it always take so long for research to get into practice, Leslie?
That is a huge deal, and I think people are really working right now to try to figure out how can we take what people are doing in the research lab and take it directly into the bedside, and that's really what I'm interested in, is looking at what are the problems that nurses and physicians have daily working with infants in the NICU, and to try to answer those questions to help improve care.
Absolutely. It sounds wonderful. Now, Leslie, of course, we, don't want you to give too much away from the presentation, but if I could ask you one thing that you hope our viewers will walk away with after watching the presentation.
I hope that they open their mind, no matter what they're doing in the unit right now, they open up their mind to different ways of practicing. And that may not mean they change their practice, but they're able to look at different ways that are potential and not just focus on, we've always done it that way, and thus we're going to continue doing it that way forever.
Yeah. And it's so easy to fall into this, right? We've always done it this way. That's why we're doing this forever, because change is hard sometimes, not always sometimes. Change is often hard.
It's very hard. And it's scary. And it's scary too.
Yeah, scary, because as well, we're dealing with all the very vulnerable patient population there. So we want to make sure we get this right. So yeah. Well, Dr. Leslie Parker, thank you so much for sitting down here with me and talking about the presentation. I'm very much looking forward to having you here at the Neonatal Online Conference of 2023.
Thank you very much.
And now some information for our viewers. If you would like to learn more about this presentation and all the other presentations in the conference, we invite you to go to goldneonatal.com. We get started with the conference on May 30th. We get started with our opening keynote presentation that is open access and available free of charge to everyone. But you do need to reserve your seat. So go to goldneonatal.com to reserve your seat there. All presentations are live, but they are also recorded. So if you cannot be there live, make sure to still reserve your seat, still sign up, because you get all the presentations that are recorded to view at your convenience. Thank you again, Dr. Leslie Parker, for being here with me today. And thank you to all our viewers who are here with us today. Bye-bye, everyone.